Welcome back to the American Health Journal. We go now to Laura Windsor, who has a report on lens implants.
Roger, we've been learning about some of the complex problems that affect cataract surgery patients. Now we turn our attention to an exciting and revolutionary development for those who need lens implant, light-adjusting lenses. We spoke to Dr. Edward Kim of Harvard Eye Associates.
In the past 32 years as a cataract specialist, I've seen a lot of changes. For instance, it used to be that we would have the patients go to the hospital for a week, and now it's an outpatient office procedure. It used to be a large incision with lots of stitches. Now it's microsurgery, no stitches. And it used to be that it would take an hour for the surgery. Now it's just minutes. So there has been quite a few changes making cataract surgery nowadays more safe, quicker, and easier for the patient.
What should a patient's expectations be after surgery, and what are targeted outcomes?
Let's say we have an archer, and he's a pretty good archer. He's shooting arrows at his target. No matter how good he is still not going to get all of them right in the center of the target. And we have the same issue in cataract surgery. So for instance, we have Mrs. Jones, who's undergoing cataract surgery. We would like her to be plano after the surgery. Now, plano means that she will have no astigmatism, no nearsightedness, and no farsightedness. That's our target outcome, or the bullseye in this case. Now, we only have patients hitting that mark in 80% of the cases, in spite of all the precision instrumentation and microsurgical techniques that we have. Now, you might ask, why is that? Why can we only get 80%? Why not 100%? Well, the answer is that there are too many darn variables involved. We have variations in how we measure the eye. We have variations from patient to patient in the structures within the eye. We have, obviously, variations in how patients heal. There's no way to know it. That's the problem. Because our measurements, even though they're very precise, can vary because of the way the patient sits, the way they turn their head, the variations from patient to patient in terms of the structure within the eye. Some eyes are bigger, some eyes are smaller. They heal differently. These are all variations that we can't predict. There's a lot of variability, and the people who don't hit the target outcome, they would be in the 20%. And of course, that 20% we can correct with glasses or contacts or even additional surgery, although we don't want to do that. We would prefer that 100% would hit our target mark. This is where the new technology of light-adjusted lenses come in. This is an exciting technology that was developed with collaborative efforts of scientists from Caltech and UC San Francisco, and it's developed a lens which responds to ultraviolet rays. The ultraviolet rays can actually change the shape of the lens. When we change the shape of the lens, we change the prescription of the lens. And by doing so, we can correct any little bit of astigmatism or nearsightedness or farsightedness that the patient may still have. This is the revolutionary effect that the light adjustable lens can provide for us. In this three-dimensional animation, we see the yellow marks representing the unique molecules within the lens. When ultraviolet radiation is applied in the central portion of the lens, it causes these molecules to polymerize, shown here by the change of the yellow molecules to blue. As you can see, this polymerized blue portion is now distinctly different from the rest of the lens. Since the central portion of the lens now has virtually no yellow molecules, and since the yellow molecules can freely move, the non-polymerized yellow molecules will then seek equilibrium and migrate toward the center. You can see that when this occurs, it changes the shape of the central part of this lens, making it a bit thicker in the middle as a result. Now, by irradiating the entire lens with another beam of ultraviolet light, we polymerize all of the molecules, as shown by the yellow molecules turning blue. No further migration can take place, and therefore the intended lens shape will be permanently locked in. Early FDA results were exceptional. 97% of the treated eyes achieved intended target. We are now part of a phase 3 clinical trial in which 12 centers throughout the country are involved with multiple surgeons. We are one of 2 centers here in California. With this technology, cataract surgery can become more accurate. We are now approaching closer and closer to the intended outcome, getting closer to the center of our bullseye. And so this will give you that fine-tuning at the very end, which is terrific.
Cataract surgery is one of the most successful procedures done. I often will say the 2 medical miracles are eye surgery and hip surgery. And anyone who's had either one of those will attest to that. It is phenomenal.
Lens implant for those with cataracts can offer the best solution to their condition and bring better vision into focus. For the American Health Journal, I'm Laura Windsor.
Coming up, new hope for millions who would like to gain independence from reading glasses. Which answer is closest to the number of working parts in the human eye? A, more than 200, B, more than 2,000, or C, more than 2 million? The answer when we come back.